During the summer months, kids spend more time outside, so there are different risks than during the winter for sustaining concussions. So the older kids will get injured during sports, but we can't forget about the younger kids who also spend more time outside, and they play in playgrounds, around the yard, and they can fall off different structures and get injured that way as well. If you suspect your child has a concussion, so you've seen them fall or you've seen them get a hit, you should look for the following things. So you should listen to what they're going to say. They're going to report symptoms like having a headache, being dizzy, not feeling right, being nauseous, but you're also going to be seeing things, so looking out for things. You have to look out for whether they look the same as they did before they got hit, whether they look a little sick or a little off, if they're more irritable, they're not the same child as you're used to seeing. Those would be signs and symptoms of having a concussion. Once you suspect your child has a concussion, we recommend you take them to the doctor or to the emergency room to get a proper diagnosis. So once you get there, what they'll do is observe them a little bit. They'll check their balance, they'll check whether they ask them if they have a headache, watch their vomiting, and once they've seen all that, they will make the diagnosis that it is a concussion or not. Once you have the diagnosis and it is a concussion, the first recommendation will be to take a little break. So no activities that are very demanding, and then you'll also restrict their physical activities. So that doesn't mean to stay in bed, but it means no sports that could be risky for them to fall off a bicycle, for example, or to get hit again on the head with a soccer ball. It also means not playing at the playground and risking falling off structures if you go. So take a few days of break. Once you have no more symptoms from the concussion, so both the child doesn't report any symptoms and you don't see any of the signs that we talked about earlier, then they can return to their full activities gradually, so a little bit more every day until they return completely. So the best way to stay safe during those summer months is to use the proper equipment, and then when you go with younger kids to the playground and on structures, provide ample supervision. Don't let them climb up and down all alone with multiple kids on the structure. Just stay close, watch them. The idea is not to stay away from playing outside. The idea is to make it as safe as we can.